very good morning again and good evening. And first of all, I'm really grateful to Professor Rajkumar because this World University Summit at this point of time is not easy, and getting over 100 vice chancellors and provosts in this entire summit. Second thing is that, we could manage and persuade people from all over the world, irrespective of timings, to come and join us because many people are being benefited out of it. So thank you very much, Professor Raj. And I would like to introduce Professor Dr. Elizabeth H. Simmons. She's Executive Vice Chancellor, Academic Affairs, University of California, San Diego, USA. I have another distinguished panelist, Professor Dr. Petra Wend, former principal and vice chancellor, Queen Margaret University, United Kingdom. I hope she's not there, otherwise it would have been like 4 o'clock in the morning in UK. Another guest to whom I know from last good 11 years is a dear friend, Professor Dr. Ashik Sarkar. He is a professor, is a great researcher in the Jindal Global Law School, OP Jindal Global University. We are going to have another gentleman, Dr. Jitendra Nagpal. I know him because he is a psychiatrist and working with the government of India for various school education policies. So that's why we requested him to be part of this. Now, but I really like this topic, empathetic university promoting wellness amidst grief and grievances. As per UNESCO statistics, it says 1.31 billion students were not having an access to educational institutes. So it could be high schools, colleges, universities, and so on. Now the whole world really talked about doctors, nurses, paramedics, thanking them. We also do that. The whole world thanked the security and police, but very few people talk about the kind of uncertainty, the kind of anxiety the students have gone through, and especially the difference between the developed countries and the underdeveloped countries. If I talk about India, there are many challenges even onto the online learning. First was the availability of technology infrastructure. You'll be surprised to know, not only India, but in most of our neighboring countries, we are just having approximately, only 23% of the people are having a Wi-Fi at home, and only 14% people are having gadgets. I'm not talking about the smartphones. I'm talking about the laptops and the desktops and so on. Not only that, these days the students are doing it on the phone. And if they have one phone, welcome Dr. Jitendra Nagpal. I've already introduced you to.
Thank you, sir. Good morning, sir.
Very good morning. Yeah. So, now as a student of psychology, I feel that once people are spending a lot of time, on screen, then definitely, the probability is high they may become an addict. And second is the future. What is the future? I'm not talking about school going students, but that also, if they are in high school and the last year and they have to take admission, they are going through hell because they are not able to get admission. Parents are not interested in sending them to the universities they want. They want their children to be near to the hometown. Now, all these students, those who were having a high hopes or wanted to go abroad or within India also, they're not able to travel. So all these things are causing a lot of psychosomatic issues in children, because we are dealing with almost 8,000 students in our university, and most of them have their issues on that. For that, I would like to have a perspective of UK, USA, India, and our law professor. So, and very good thing they have done that they have already, given us the the questions, and but I'm going to ask you a few questions of my own as well. So, the first question, and we would like to discuss only on one particular aspect for not more than 2 to 3 minutes, but we want to understand your perspective on this. So, the first question goes, in the context of the ongoing pandemic, how have the various stakeholders, students, faculty members, and staff members of the university been affected? How has this been different from the pre-pandemic grievances? May I request Professor Simmons to let us know about her viewpoint on this.
Thank you very much. I'm delighted to be here to be part of this important conversation. I think that during the pandemic, we heard much more from all stakeholders about the desire to be much better informed and to be part of conversations about how things were being organized at the university. And there was anxiety when people felt if they felt they didn't know what the plans were or didn't have a voice in the plans. And while before the pandemic, people always liked to be well informed, I think now it became much more important because there was so much uncertainty related to the pandemic. Students then had exactly the sorts of issues you've been talking about with respect to technology. The employees mostly had it, but not all of the students. And that was certainly a source of challenge. We ended up lending over 1,000 laptop computers and Wi-Fi hotspots to students so that they would be able to connect with their classes. And those were just a few things, but I think also just the isolation everybody expressed was a source of real challenge. Let my distinguished colleagues contribute as well.
Sure. Professor Petra, Wend?
Yes, in the UK, it was very, very similar. So although we are perceived to be a developed country, we had exactly the same issues as well. The anxiety was there among the students, but also clearly the disadvantage of some students not having access to technology. And even if they had access to technology, very often they would be in noisy households or they would be sharing the laptops with somebody else, so there were no study spaces. In the UK, we're trying very hard to narrow what we call the attainment gap. So the gap between those students who are privileged and those students who are not so privileged. And we certainly feel that the pandemic made the attainment gap worse rather than making it better. So this is clearly one of the issues. And the other one is obviously the issue of isolation as well, particularly for students starting, because many of them moved into halls of residences near their universities away from their parents. And suddenly the pandemic started and they had to isolate in their halls of residences away from their family and not even being able to meet their fellow students and have any social contact. So that was extremely hard for them. And some have never returned to campus. So those who were first year students still have not set foot on campus, and they're missing out on the vital experiences that students have as newcomers.
Great, thank you. In fact, I just introduced, but let me tell you that Dr. Jitendra Nagpal is a distinguished, very accomplished psychiatrist and doing a lot of work with school children. Is very popular among all the school children in India, and he's also closely working with the Ministry of Education, Government of India. So what are your viewpoints, Professor Nagpal?
Good morning, sir.
Very good morning.
Really honored to be in the midst of such an august gathering. Undoubtedly, sir, I agree with our honorable speakers here. This has been a major onslaught on humanity, the entire human race, and also the abundant population of youth in India. We are gradually seeing emerging trends of psychosomatic, emerging trends of helplessness and a feeling of loss of identity. To me, I think the pandemic has no doubt been an opportunity to relook into the way we define the psychosocial well-being of young people in the nations. And I think for India also, this has been a impossible period to actually bring about a cohesive communication between young people. As we heard rightly, when the campus is off, it is online virtual medium that is bringing people closer. But let me tell you, three factors. Whatever we have been doing as small surveys, interacting with the young people, the peer educators on the campus, in the schools, especially the middle and the later adolescents, we are coming across a loss of identity of that developmental period. You know, we all know the sense of belongingness to the family and a sense of purpose. First time, probably in the history of human race, the youth who has a great amount of ambition, great amount of a skyline of planning in life seems to be shattered. Many of them have come across in hundreds of helplines in the country where they talk about a complete sense of existential anxiety. It's like, I don't know whether life is worth, what is the purpose of my occupation now? I tried to go abroad. I tried to get into some of the best universities. I got them, but nothing seems to be working. So that's the worrying part. We have about more than 1,000 plus universities in the country. And let me tell you that though the data is still emerging, one of the highest rates of suicides in the world in young people, the adolescents and the college youth, the first year and the second year. And this has not only brought in a snowballing effect the last 18 months, but also a sense of detachment of communication and care coming in from the family. They feel that the young people feel the sense of isolation within the larger family system, the communication gap between the elders, the grandparents. So the sense of detachment from the family and also the peer group. Peer group plays, we all know very well, peer group plays a very dynamic, intensive role in bringing about a personality change in people, especially the 15 to 20 years group. Now that seems to be stagnated. The dynamics have come to a standstill. And that has led to a spectrum of depressive disorders, a spectrum of anxiety and panic, insomnia, aggression, let me tell you, defiance and hostility. There are so many parents who have come, so many families who have come to us across the country, our fraternity, where they feel that there is a pattern, an acute pattern of change in the behavioral profile of these young people. So we need to do really something very important to have a connected advantage of the virtual medium, connecting the family, the campus, and the student to bring about a psychological well-being phenomena that keeps everybody bound to each other in terms of empathy, self-awareness, and some kind of a critical thinking that allows mental health to be on the national agenda. These are a few words in the beginning.
Thank you, Dr. Jitendra Nagpal. And I also share my views, what you said, very relevant. But, a few people were talking about, the students are not able to go to school. It's a quality time at home, and there will be a better bonding between the parents, which I did not see it much. So we'll come back to you on this. Sure. Now we have a teacher, a great professor, and who has taught at least 4 courses in last 1 year to law school students of our university. I'm sure he will tell his experiences. Over to Professor Ashik Sarkar.
Thank you, Dr. Sahni, and thanks to the other panelists for their thoughts. In response to the first question that you've posed, I'll offer 2 connected observations. The first one being that neither our stakeholders or universities or the experiences of the pandemic, none of these can necessarily be understood as experiences that are universal in nature. There are pre-pandemic conditions that have in fact been exacerbated through the pandemic. So if you think about the nature of the university in question, if you think about its location, the socio-economic status of the students, for example, structural factors that contributed to forms of disenfranchisement prior to the pandemic, have in fact been exacerbated by the pandemic. So I don't think stakeholders are necessarily impacted in a similar fashion. But that in itself, I think, is a particularly interesting, interesting is a bad choice of word, for describing a period that's seen so much devastation. But I think there's a certain kind of contradiction at the heart of the consequences that the pandemic has produced. So on the one hand, we have seen an exacerbation, an intensification of structural inequality that was already present in pre-pandemic times. So I'm quite certain that racially minoritized students, or students from Dalit communities in India, for example, have borne the brunt of the pandemic in a way that cannot be compared with students from more privileged backgrounds. And at the same time, I think this exacerbation of structural inequalities is also accompanied by a certain perception of the pandemic being a leveler of sorts, because there's the nature of paranoia, of fear that accompanies the period when you're at home, is in fact something that even privileged people didn't possibly experience earlier. So the home, as a place that we would generally think of as the place of safety, as a place of security, is not one anymore. The point here is that it possibly wasn't the place of security and safety even earlier. It's just that, for example, let me take an example here. For students who had to be forced out of their houses, out of their residences in the university space, particularly public university spaces, maybe some of them had to go back to abusive households, households that don't necessarily offer the necessary kind of support for carrying on with online education. So my response to the question posed is that we cannot necessarily use a way of understanding the impact on quote unquote stakeholders in a fashion where we can flatten their experiences. The pandemic, while on the one hand can be read as a leveler of sorts, that irrespective of your socioeconomic position, you are living with a certain sense of uncertainty, fear, paranoia. But I do also feel that the pandemic has intensified pre-existing structural inequalities. Taking that into account would be possibly one of the first steps that teachers and university administration needs to take on board. So I'll stop there for the moment.
I agree with your all points, but if I talk about our own country, it's only from the teacher side, the school side, whatever is possible is possible. But when you don't have an access to technology, you don't have an access to gadgets, you don't have an access by the school, in fact, most of the schools are in the remote areas, even schools doesn't have, or the teachers doesn't have, then it is not basically a question of inequality, it's a question of affordability. So the people, privileged class, the rich people, their education is continuing, and there is a research by the Graduate School of Education by Harvard University that online learning is quite effective. And they have given, is one of the papers I've read, they said that what we teach in the classroom for 1 hour can be easily managed in 40 minutes through the online. So there are conflicting researches. It's not that can applicable everywhere, but now the point is we cannot provide technology. Schools or universities cannot. Now the only thing is that how COVID-19 required resilience and adaptation, not only from system and institution, but also from individuals, what Ashik was talking about. Social distancing is one of such adaptation. In fact, I hate the word social distancing. It should be physical distancing. At this time of the pandemic, we want to be socially secure. So, however, the need to remain physically distant doesn't have to mean a loss of social contact. How important is it to engage in dialogue, conversations, experience sharing? How can universities create mediums of social contact even in the virtual environment to ensure that social distancing does not necessarily result in social distancing? So anyone?
That was certainly one of the issues that we had to confront early on. We were fortunate enough to have the resources to enable 9,000 of our 40,000 students to live on campus. So we were confronting that both for the students who were living with us, but taking their classes remotely, and then the students around the world taking their classes remotely. We worked on it in a couple of ways. One was by empowering our student organizations and teaching our student organizations how they could continue so that students could build community among themselves. Another was to hold various events that were very pertinent to what was going on, particularly in the nation at that time. You may be aware that we had an unusual amount of social unrest in the US, both due to the political election cycle and then due to the really tragic murders of a very large number of Black Americans in the last year. And so to make sure that the students were not alone trying to deal with the extra emotional burden of those incidents alongside the simply trying to keep up with their learning, both the faculty and the staff organized events where people could come together to learn something about the situation, to share their feelings and thoughts, to learn maybe how they could participate in taking some form of constructive social action. So we tried to help them feel that they could stay involved in the national community and the national issues, as well as in their local organizations, in order to feel more of a sense of personal and societal connectivity.
Great. Yes, please.
Yes, sir. I have a point to share here, sir. Undoubtedly, I think there is no two thoughts about the fact that there are three dimensions of dynamics which have happened, especially for the youth. One is we are coming across a large population who is extremely resilient, as you said, and they are taking this as a opportunity to bring about a better strength of a youth population in a country. In fact, they're taking leadership role. Second is, as we have agreed, there is a opportunity to identify those who have already been vulnerable to mental health conditions, and this has been a major, undoubtedly the first in the last century, a major onslaught for scaling up the vulnerability. So these are the people who are likely to move into the psychopathology or disorders. The third category, who were already under, as a clinician, I'm telling you, as a large population of young people who avail within the campus of a university or a school or outside the campus. They avail mental health services, like OP Jindal has a fabulous linkages of mental health services. That population probably went into relapses also. And that's a population which again became more vulnerable to a large number of anxiety spectrum, depressive spectrum, psychosomatic disorders, and not to forget, substance abuse and self-harming. The four categories which we have been coming across in patches of research. So again, the onslaught is on the young people who need unconditional psychosocial support, whether it comes from the campus or a renewal of that compassion and care with communication within the family, or, well, peer group. I have come across young people. In fact, the National Peer Educators Forum, you're very well aware, sir, under the Ministry of Education, Manodarpan, we just formed that, and we found there are scores of students coming from schools who want to build up a peer chain, the empathy chain within the peer group. I find this is a connecting, the bridge over the waters between the campus and the family. No doubt that family as a renewal of maybe a quasi-therapeutic alliance for mental health with the child and the adolescent and the youth seems to be emerging as a human resource. The first aid in mental health, our family, our teachers. That's the first aid we can escalate for future trainings, also build up that human resource. because mental health manpower or psychosocial support manpower at a professional level will always be lacking. India has hardly about 15,000 clinicians. So we need nothing less than maybe lakhs of them. So our faculty, our teachers, our parents, our grandparents, the first aiders in mental health, I found this to be a very good opportunity to bring them into the closed circle of a support group for the young people.
Great. Yes, Dr. Petra, please.
Yeah, perhaps if I could start just with some practical examples of what we did, and then perhaps a more general point about a supportive atmosphere online. So the first, in terms of examples, what many universities in the UK did, they organized social events online for students. So that might be coffee mornings, for example, or what is also very much linked with health, mental health, is also physical health. So we organized classes, sports classes, but also cooking classes where students could join in, because if you eat well and healthily, obviously, then very often your mind is healthier as well. So these are practical things. But yeah, well, the other practical thing is also that universities in the UK, and I'm sure in other countries as well, have counselors who help with mental health with the students. And so they were very, very busy. And in fact, more were employed to cope with online support as well. But for me, what is very important as well is that everybody comes together. So whether it's the leadership or staff and students, understanding all of us together that we are in the same boat. Because what happened in the UK is that students turned very much against the universities by saying, you are chaotic, you haven't organized everything well enough, you're leaving us to our own devices, we have to pay fees, we have to pay rent, we want our money back, and so on. And what many students didn't understand is that the vice chancellors themselves were given 3 pieces of conflicting advice from their governments every single day. And they had to work so hard to keep the universities going. And those universities where students understood that we are all in it together, this is also where more a sense of belonging happened, and students didn't feel so angry and felt that, yeah, we are part of a community where we are trying to get out of the troubles and out of our problems together. So that, I think, was very, very important, or is still very important.
Great. Ashik?
Yeah, I'll echo most of what has already been said. I'll make 3 quick points. One is that I think particularly the role of the teacher under these circumstances is in many ways to be the liaison between the administration and the students. And I say that with some trepidation, because it isn't always necessarily the case that the teachers, either on the administration side or the student side, they do walk a tightrope of sorts. And that to be a teacher under these circumstances is also to take on board the vulnerabilities that teachers themselves are facing, for example, losses in their own family or similar nature of paranoia. If you have caregiving responsibilities at home, to be able to keep up with teaching responsibilities alongside those caregiving responsibilities. So sometimes your ability to live up to the role of the mentor, in fact, majorly suffers under these circumstances. Now, this is connected to my second point, which is that what the pandemic sometimes can actually do and do well is to unsettle the relationship of hierarchy between teachers and students in the place of the classroom, even when it's virtual, because you actually start discussing experiences of vulnerability in that classroom space, where in a certain sense, there's a democratization that happens in the relationship between the teacher and the taught. And I think that's quite important. It's important for a reason that Professor Simmons was talking about, which is, what is the use of teaching a course under exceptional circumstances like the pandemic where what you see happening outside of the classroom space or your homes, for example, the Black Lives Matter protests in the US on the one hand, or you see, thousands and thousands of migrant workers walking bare feet from cities back to their villages, dying on railway tracks without food, for example. Now, what relevance is there between all of these images of devastation and suffering on the one hand, and what you're studying inside the classroom space? So I think one of the things that I tried to do, and many of my colleagues also tried to do, is to not treat the subjects that were being taught merely as forms of technocratic training, where students are only being trained in a certain set of skills that they can then use to solve problems later in life, but to make the content of the subject more relevant to everyday life. And I think that in many ways helped us create a community, however fraught that community might in fact be, but at least a place where the possibility of discussion was not limited to the technicalities of a subject alone. Now that leads me to my third point, which is that sometimes from an institutional point of view, even if unwillingly or unintentionally, there might be a tendency towards psychologizing or pathologizing, quote unquote, trauma. I think while institutional responses that put in place necessary access to mental health and support is absolutely necessary, and there is no alternative to that. While at the same time, I do also feel that psychologizing the experience of the pandemic, be it in the nature of fear, trauma, or paranoia, isn't necessarily going to be the most effective way of responding, which is why I think the classroom becomes an essential space that can be rethought as a community that can share experiences of vulnerability of whatever kind it might be, where you don't need to constantly take recourse to the language of therapy, for example. So
Could I briefly respond?
Please.
Because I was really struck by what you just said, and I had the privilege of co-teaching a small senior seminar on the topic of racism and anti-racism in physics, which is my own field, in the spring quarter. And it was extraordinary what a tight-knit community we became with the students, and how the students could use the opportunity to open up about what was bothering them, about world issues, about personal issues, how they intertwined, and how they related to the intellectual topics. And it made them, the topics then weren't abstract, they were very directly related. So exactly what you're saying, and it was an amazing experience.
I may have a different experience than what Professor Simmons and Ashik Sarkar is talking about, because I also taught good 5-6 courses. Now, first of all, yes, we understand the problem exists. We understand there are technological challenges. We understand that maybe they don't have that kind of a facility at home where they can open their videos. Now, the first of all, most of the time what has happened, not in India, I have seen abroad also, that the students log in and we don't know whether they are there or not. And I am more concerned about the mental health of the faculty than even the students, because the faculty only talks to the screen. That's it. And many times it has happened, you keep asking, is it possible for you to switch off? People don't even respond. You ask any question, sometimes people, yes, I'm not saying the 100%, but maybe 20% people are responding. Second is that, many students will probably, quote unquote, exploit the system as well. Giving us more time for examination, 20 days, 30 days, 40 days, 50 days, and so on. So my question is, what is happening? The good performer students, they are feeling bad about it, that they want. Similarly, what has happened, the class 12th, which is a high school last year in India, is the board, the examination board has cancelled the examination. And now they are working on that of a model where class 10th some percentage, class 11th some percentage, and the unit test. But let me tell you, in India, it's entirely different thing, because most of the bright students, they go to the coaching centers. They don't care about the final exams of the examination board. And now they are suffering. They might not get admissions. So my question is more not onto to that part, that resilience and adaptation by the faculty, by the student, by the administrator was more important. And I really liked a few practical things like social events and cooking classes and sports classes and so on. These things, at least. But the problem is, most of the time, students don't turn up. And but we need to keep on trying. My next question goes that according to the white paper published in The Economist titled Bridging the Digital Divide to Engage Students in Higher Education. So 66% students said that they are not mentally prepared for the next semester. In the light of this, what can universities do to motivate the students to continue education? Yes, please. Anyone? Petra.
Okay, I'll start. I think it's still the same point that I made earlier. Again, that this topic of we are in it together. I think what is important is that we stay in contact with the students, not only online. So we are trying letters, we are trying telephone conversations as well, and also trying obviously to get students together into peer groups as well, so connecting students with each other. But what is also important is celebrating, because I think we've all gone through such a development to start with. We really didn't like what we were doing. It was chaotic, we had to learn. Then sort of halfway through, we got quite comfortable, and that also involves students. So it's not that all students are unhappy. So in some surveys being done, some students actually prefer this way of engagement, simply because it seems more anonymous, they are less scared, they don't have to commute. So there can be advantages. But what is important is that students, despite the circumstances, do feel proud of what they have done. So again, what some universities in the UK have done, they've tried to do celebrations of any kind of achievements. So they were either online, or if it was possible, in a physically distanced way, having on-campus celebrations as well. I mean, they're a nightmare to organize, but it can be done. And if students, even in a physically distanced way, see each other and feel they are part of something else, and see that other students are suffering from the same circumstances, I think they will feel much better prepared for the next semester, for the start of term, because they know they are not alone in it. So it is, again, I think what is also important, what history your university has. So if your university has a history of well-being, connectedness, and openness, then that translates quite well to online or other socially or physically distanced events. If that has never been the case, obviously that is very, very difficult to build up in the time of a pandemic. But at Queen Margaret University, we've always had the incredible atmosphere that we can be open and transparent, and that people will not be victimized if they do not understand something, or if they do feel insecure, so that everybody can actually say, I need help, and what can it be? So therefore, when the pandemic happened, our students actually did feel reasonably well looked after, for the simple reason that the atmosphere has always been there, is you're not at fault. If there's a problem, please ask. What we also do have, it was mentioned before that students simply do not attend some of the classes. We have a system whereby if students do not attend 3 times in a row, they're automatically picked up and they're phoned at home. And they're asked, is everything all right? Do you have problems? Do you need help? Financial help, mental help, anything else we can do for you, just to really have the early warning signs. So it's a very much, it needs to be a coherent, integrated system. And if you do have that, I think students will feel better prepared for the next semester.
I agree. Perfect. Thank you very much. Dr. Nagpal?
So, I think that's a wonderful variety of inputs coming in. I go back to the point where I left, and I think listening to everybody has instigated more ideas, what we have done, what we're trying to do. One is, look at it the optimistic side. There is no doubt this is a great time for altering the way lessons are imparted, bringing about a change in the living and the celebration of life. Three things. So when we are looking at living, whether at home or in a non-campus environment for the time being, and celebrating life, there's no doubt that lessons have a way to be imparted. The students, whether it is the middle and later adolescents or the youth, will not be probably comfortable with the conventional modalities, as Professor Sahni, you mentioned, switching on and logging out and the lectures being addressed to a wall. That's a phenomena at the school level also. Teachers have had great difficulties. Pedagogy is going through a lot of transition. So why not? Why not then involve student as a teacher, student as a imparting authority, and preliminary part of the lessons. I've seen teachers actually, suppose for example in social science they're studying about the sustainable development goals. If there are 17 goals, there are 17 students preparing PowerPoints and matter and presenting it, and the entire class goes through the rebuttaling, the discussion. Then celebrating Human Rights Day, celebrating the World Mental Health Week last year, celebrating the International or the National Youth Day on January 12th. I mean, these are events which are never possible offline. And the campus would be how many? 400, 500 people? We had about 18,000 adolescents participating. Professor Sahni, you were there in that, across the country, online. So this is also an opportune moment to bring about a differential approach to adolescents and young people and their lives and living, not just the lessons being imparted out of the syllabus. Let's go beyond the syllabus, make it a curriculum, that this hybrid learning, this blended learning, and this flip classroom, the flip side of the classroom, where you the teacher, we the learners. So faculty and students become a family. And I've seen in schools, of course, sir, where middle school and high school adolescents, mother, father being the teacher, they offer their services to the school online. We have professions of the parents coming forward for career choices. So it's a great amount of involvement of the family in the high schooling and the higher secondary schooling. So I think a creative moment is here with us. The pandemic has given us a creative opportunity of the head, heart, and the hands approach, the 3H approach to understanding education from a developmental point of view, with participation of the learner in the forefront. Why not create that moment? We will have less mental health conditions which are needing urgency as a help. We will probably be coming across adaptation difficulties, acclimatization difficulties, which are part of any resilient movement, any time in life.
I must tell you that the audience has asked 15 questions. So, we need to talk to them as well. So, many things we have addressed, but the first goes, how can universities identify youth who need support, especially during these pandemic times? In fact, we have discussed, but the second question, how did universities deal with isolation felt by the different stakeholders and help in dealing with mental health issues, especially in India? And I personally know the stigma attached with the word psychology and mental health. Not many people or students are interested asking for help. Second is the confidentiality issue. They think that when they are going to go to the university wellness center, it might be leaked out that what kind of things they are suffering from. So there are certain issues. Anyone can address this? Yes, please.
I'd like to build off of what you just said. to the issue of confidentiality, we found that offering mental health services online, either individual or group, helps with that, because you don't have to go to a building where people could see you going into a building and comment on that in any way. And we found that that gives students a greater sense of privacy and access and confidentiality. And I know we're not alone. This is common now in the U.S. universities, and that's something that we'll be using in the future as well, even when we're able to have mental health services also provided in person. The second aspect, I think, goes back a little bit to what I think Petra said earlier about, and what several of you have said earlier about the issue of stigma, but also the issue of wellness. And so trying to have a whole spectrum of ways to engage the students, from healthy eating and wellness and exercise over into self-reflection, self-regulation, dealing with stress, over towards things that are much more in the domain of counseling, and making it almost like a zero entry swimming pool or something. You know, there's no barrier between you and these sort of reflections or surfaces or services that you might need. So it feels easy to stick your toe in the water and kind of try it out, and very little stigma. So we've certainly found those approaches to be helpful.
Anyone else? Otherwise, there are many questions. Ashik, for you also, there's one more question. That is, how can, I really like this question, how can universities decrease cheating in universities now that it is easier than ever with online exams? Do you think this is going to bring the standard down? Interesting questions. Please go ahead, Ashik.
So I had a previous point to make, and I'll try and see if I can connect that, think of a response that connects to this question. While it's kind of become axiomatic to talk about the experience of the pandemic in a way in which Professor Wend put it, that we are all in it together, and clearly that's true. We also do know that we are not impacted by it in the same way. So we might be in it together, but we are very differently impacted because of a whole range of structural, historical, cultural reasons. Now, the reason I'm pointing this out is to foreground something remarkable that I think different parts of the world has seen in the wake of the pandemic, which is the emergence of mutual aid communities. Now, I'm highlighting this to emphasize on the fact that while there have been several forms of institutional innovations that have taken place within the university, as well as at the state level, for example, but the pandemic has also in many ways demonstrated the failure of institutions. And it is in the face of the failure of institutional forms of response, which isn't necessarily particular to the pandemic, but is an outcome of historical forms of injustice, that we have today seen the emergence of community-based support systems that have possibly worked, far better than some institutional responses. And particularly in the context of the question that was posed earlier about, the uncertain future for students who might want to go abroad, or to study or higher education, for example, something that we've seen in India, and I don't know what the experience is elsewhere, is that if there's a student from a marginalized community, and who has secured admission into an institute of higher education abroad, but does not come from a privileged background to either be able to fund their own studies, or is unable to actually gain state support to do that, mutual aid communities on the social media space have actually raised funds, something that's never happened before in such a concerted fashion, to actually ensure that first generation learners who have the opportunity to now go to some of the world's best universities to study can do that. And this in a way points at both the failure of institutional mechanisms and at the same time the emergence of community-based mutual aid support systems that have worked quite remarkably well. They cannot replace systems. That's important to keep in mind. Mutual aid does not replace the state, for example, does not replace the university, but it does point at the, even when universities are trying to reinvent themselves, it does point at the failures of the system. So that's one part of what I have. The second thing I think is connected with regard to the question that Dr. Sahni posed, a question that's come from someone in the audience. How does one prevent students from cheating? And I don't think this is a situation that is necessarily unique to the pandemic. Plagiarism in higher educational institutions, when students submit assignments is endemic. Wherever you go, you have massive there's an industry of anti-plagiarism software that exists because universities have to subscribe and buy these facilities to be able to check whether students are copying or not. But I think the problem really is less about whether students have better opportunities to copy and pass off work as if it's their own under pandemic circumstance. I do think, and this is a point not related to the pandemic really, but to pedagogy in general. I think one of the things that higher education institutions, irrespective of the discipline, possibly don't pay enough attention to, and I would hold myself guilty for it as part of a higher education institution and as a teacher, is training students to read. I think that assignments focus too much on a part of a skill that we call writing. But I think reading and practices of reading can produce skills of how to be empathetic, for example, because reading enables possible flights of imagination where you can actually put yourself in the position of somebody who you'd possibly never be in your life. And I think forms of connection and relationship building with characters and ideas can emerge from the way you're taught to read. And I think that in many ways can play an important role in helping students find their own voice, where they don't necessarily have to fall back on templates that they have to then use to copy and produce work. So I think, I'm making a broader point about a pedagogical practice that I guess teachers need to pay more attention to, which is training students to read in a particular way. I mean, this about, of course, is a practical problem in certain disciplines, which is that if there are too many assignments to submit, through a semester, that in many ways, if not actively but tacitly, can promote ways of turning in those assignments where students end up copying from each other or from repositories on the net, so on and so forth. So I think it's again a systemic problem rather than a problem that can necessarily be addressed at an individual level, the matter of copying. And I don't think it is necessarily peculiar to the pandemic.
More than a systematic problem, I think it is your mindset. It is, how you take things. So it is not. So the cheating, I will take it, is kind of a fraud, which it's a kind of a behavior. And and there are many systems of evaluation or assessment of students, which could be a continuous assessment, need not to be have an examination at the end of 3 hours kind of thing. So, that can be worked out, but this is a more a behavioral issue rather than a systematic. Yes, Dr.
I mean, I would disagree partly with you, Dr. Sahni, because I don't think we can completely pathologize the experience of cheating entirely. I think it's a product of a certain kind of education system and not merely individual forms of behavior.
We cannot generalize these kind of things anyway. Professor Dr. Jitendra Nagpal.
Yes, sir. I think we are indeed arriving at a consensus on what could be a roadmap. There's no doubt that when the discussion about cheating is happening, I don't think, Dr. Aushik, there is a movement to pathologize or psychologize. It's about also a well-being spectrum we need to look into. Even cheating may have a broad approach to identify those who are repeatedly indulging into it, and they are. Obviously, there are so many of them who have come under the surveillance of the campus, despite all the approaches given and all the sanctions being discussed, because it is not a phenomena confined to only few, agreed, but this so-called opportunity and leading to online cheating, it does bring in the fold of all three. Are we looking at a primary mode where even the regular student is indulging in it, or the ones who are more vulnerable, or the ones who are repeatedly were known earlier also? So it is okay to take a pathologizing approach, but not completely that only, because then only you will identify the flag signs of those. And I think any consensus the world over, when the WHO declared this as a mental health pandemic also, will identify a certain percentage of young people who are more vulnerable than others, and they might be into behavioral issues, need not be behavioral disorders. That's why I think the discussion today needs to go back with the ideology that discussing mental health promotion is not reducing mental health disorders or diseases or psychopathology. Discussing mental health conditions is promoting a sense of well-being on the campus, involving the student, involving the peer at the helm of the affairs. India has now tried to take from the new education policy after 34 years. The curriculum-centric approach is moving into the student-centric approach, where the ownership of the learning and the learning outcomes lie in the hands of the student. Teachers, faculty, and maybe even the allied teachers, they are the facilitators. So why not take this as an opportunity to minimize those conditions which may or may not move into a pathological zone? And we know that's one research. But one side, I think, let's create well-being campuses as we are going through the meaning of an empathetic university, but involving students at the helm, inviting them to take on even discussions like why cheating of this magnitude, apart from a whole lot of behavioral issues that are coming up. But the issues need not be confused with pathology. I want to clarify that. Issues need not be called disorders or labeled. That is stigmatizing, unless there is a group who needs clinical help, which could be a little more during the pandemic than the pre-pandemic era. Therefore, the time has come for centralizing the education approach in the hands of the student with concerted orientation to that. I told you, the My Opinion Matters is a movement happening with the peer educators in schools and colleges. My opinion matters. So if their opinion matters, let's invite them to also tell us about how lessons need to be imparted away from the lecture halls, how syllabus and curriculum needs to be completed. I think voice of the opinion is a true democracy, where this is the right time for universities across the globe, mainly in India also, to listen, to acknowledge, and also celebrate the power of the youth to transform education.
Wonderful. And it's 9:45 and there is an alarm. So thank you very much, Professor Simmons, Professor Petra Wend, Professor Ashik Sarkar, and dear friend, Dr. Jitendra Nagpal. In fact, we are getting many comments where people are very happy. Many educators and students are attending these programs. They are sending a lot of messages that they really enjoyed and learning out of it. Wonderful, and thank you very much. At the end, I would like to mention that what Professor Rajkumar has done, even during the pandemic, collecting over 100 universities for this summit, is highly admirable. Thank you very much, and be safe, be healthy. Thank you very much.